Hello. Hi, I'm Dr. Maria Sulindro, uh, Integrative Aesthetic Anti-Aging, and today I welcome you to my channel for a topic called diabetes. My practice is in Pasadena, California. Now, this topic reminds me of my own personal family story where most of my family from my father's side and from my mother's side, they all have diabetes and they all have, most of them have stroke and cardiovascular history and also cancer. So right now I'm practicing integrative medicine where I also exercise the epigenetic or lifestyle changes for my patient who has diabetes. And this one helps me to understand a lot about who they are and why they are not able to reverse their diabetes or why they are able to. So today I'm going to just explain the overview of diabetes because next month I call it an endocrinology month. So we discuss about metabolic disease. Diabetes is a metabolic disease. Basically, the body failed to, for some reason, to metabolize the sugar that you have. The sugar remains in the blood. So after fasting for 10 hours, the sugar is still high in the blood when you test it. So usually, this is what you see. One moment, okay. So I'm going to share screen with you. So I'm going to show this one. So when you have a blood test, you actually have a fasting blood sugar or glucose. And when it reads more than 100, this one, 185, and then it says age, which is high, then the sugar should be 2 hours after you eat, be kept in the cells or in the liver to be used later on. But this one, fasting blood sugar, after 10 hours usually, and it's still 185. HbA1c, hemoglobin A1c, is also, it becomes the measurement of all the stages of diabetes, including pre-diabetic or diabetes or non-diabetic, okay? So this is what you usually see when you check the blood test, and we usually use the purple top tubes. So hormone that convert the sugar and put it in a cell is called insulins. They move sugars from the blood into the cells. With diabetes patients, your body either don't make an insulins or do not make enough insulins or cannot effectively use the insulins to keep the sugar in the cell. And such, for example, keep it in the liver to be used in the future for energy. Hormone insulin from pancreas is an organ. Hormone insulin is produced by pancreas, and pancreas is the organ behind your stomach. Okay, behind your stomach there is pancreas. I think it's in this side, and it is a naturally occurring hormones. And it moves sugars, like I said, from the blood into your cells, and then it is stored. And at any time when you use it, for example, you move or you do an exercise, you need energy, and then it is pulled out, and then it becomes, and you can use it, okay? So some patients cannot produce insulin at all, or some patients, the insulin is produced, but it doesn't work, and it is called insulin resistant. You heard about that terminology probably. Symptoms of diabetes, let's just discuss about that. It's called triad from 3 symptoms: increase of thirst, They sometimes have dry mouth and they feel like they have to drink all the time. They are hungry, increase of hunger, especially after eating. They still feel hungry again. And then frequent of urinations. Some of them, they have an unexplained weight loss, even though they hungry and they eat, but they somehow lost some weight, okay? They are weak and tired, often tired, and they have some complaint of blurred vision. They have numbness and tingling in their extremities, their hands or their feet. And if they have cut or wound, they have slow healing process. And then the skin sometimes is dry and it can be itchy because of dryness. And many of them, they experience frequent urinary tract infection or a yeast infection. Let's understand how the sugar is actually utilized. Okay, let me share with you again this one. So when you see the red arrow here, okay, so it says high blood sugar, and then that promotes the insulin release from the pancreas. So this is the pancreas. And then when the insulin is released, either it promotes the glucose to be kept become glycogen like this, and so it can also lowers blood sugar. Also, the insulin keeps your sugar in the tissue cells. Now let's see when you have low blood sugar. When you have low blood sugar, and the pancreas will release glucagon, which is another hormone, and then the glucagon stimulates glycogen breakdown here, okay, and then it raises blood sugar. So this is how what happened in your body. Okay, so let me see. All right. Now, early symptoms of, remember, it also can lower the blood sugar because of the glucagon. So the low blood sugar symptoms is like you feel weak or dizzy, including sometimes it's so weak that you tremble and feeling shaky. And then you feel hungry. Sometimes you sweat, you have pounding heartbeats, pale, you look pale, and feeling sometimes frightened and anxious because your sugar is low. And then the late symptoms of low blood sugar, it can give you headache, confused, and you cannot focus, and poor coordination. And also you can have nightmares at night and feeling cranky, numbness in the tongue, and sometimes you feel like you're fainting out. When the sugar leaves the bloodstream and enter the cells with the help of the insulins, the blood sugar level is lowered. You have to understand this for those people who also takes insulin. So if you don't have insulins, that cause the blood sugar will rise. Okay, too much sugar in the blood, it's called hyperglycemia, or too much sugar. Well, it's high sugar. Okay, so let me see. After 3 hours of eating, now there are steps here. There are 5 steps. When you consume the food, okay, and the food is broken down into the sugar, or glucose is sugar, amino acid, which is precursor of protein, and fatty acid, which fatty acids is like essential fatty acid, omega-3, omega-6, omega-9. Now, and then the blood level will increase from the food that you consume. Now, what about these? These are two hormones from the fat cells, leptin and ghrelin. The leptin will increase the fat, and then ghrelin will reduce it. So when blood level increase of contents of sugar, amino acid, and fatty acid, the pancreas will release the insulin. And when insulin is released, the insulin becomes the shuttle nutrients into the cells to be stored as a glycogen, fat, muscles, or used as an energy. Okay, so on in your body. There are three types of diabetes in general. Type 1, type 2, and gestational diabetes. So type 1 is usually called no insulin diabetes. Okay, juvenile diabetes, or where they cannot produce insulin at all, or they produce some insulins, but not enough. Type 2 is you have insulin, but you cannot utilize the insulins or utilize the sugar. Now, gestational, when you're pregnant and the blood sugar rises due to the hormonal situation as well. Normal people, when they are fasting, their sugar ranges from 80 to 100. And when you just eat, ranges from 170 to 200. After 3 hours, it should go down to almost 120 or probably 140. For pre-diabetic patients, pre-diabetic is when the insulin is also not working as well, okay? The fasting blood sugar is usually 100 to 120. And then when after they eat, they have all the way to almost 250, a little bit higher than the normal person. 3 hours later, it doesn't go down to 120. It usually just stay at about 140, 160. Now, what about diabetes? Diabetes patients, when they're fasting, they're 120, 130 or above that. And then when they just eat, within 3 hours, their sugar it can goes up all the way to 200 or 300 or even more. And then 3 hours after that, it doesn't come down below 200 and still stay at 200. Type 1 diabetes. Let's talk about type 1 diabetes first. The body does not produce insulin. So usually appears during childhood or adolescence. It can develop also in adult. It doesn't have to be childhood or young adult. It can develop during adult. Now, the sign and symptoms appears to be similar. Increased thirst. This is very, when you see your children, 5, 6 years old, they pee all the time, then you have to suspect they have a problem with their insulins. Or they bedwetting in children, okay, who usually did not wet the bed, and of course this is at night. Or extreme hunger, they eat and always hungry, and sometimes you can see unintended weight loss. Irritable, and they have they are very moody, fatigue, often they feel weak, and very often they have blurred vision. The exact cause of type 1 diabetes is unknown, but there are different factors, including genetics. But usually, the body's own immune system, which normally fight the harmful bacteria or viruses, mistakenly they destroy the insulin-producing cells in the pancreas, which is the islet cells or the Langerhans cells, which is alpha cells which produce the glucagon, and the other one produce the insulins. So this was studied. The viruses and bacteria problems was published in Mayo Clinic August 22nd, 2020, recently. In fact, I read also about how, despite the research, type 1 diabetes has no cure, almost like sounds like that. But the treatment usually focused managing blood sugar, and level of insulins, prepare their knowledge in terms of what diet they have to eat, lifestyle. So it just preventing the complications. With the help of insulin therapy, the type 1 diabetes can actually live long and keep healthy life. There is no known or way to prevent type 1 diabetes. But in the meantime, if you are diagnosed with diabetic autoantibodies, which you can test that one, these are more common seen in type 1 diabetes. This will help your doctor to decide whether you have type 1 or type 2. Or sometimes if ketones is found in the product breakdown of the fat, okay, found in the urine, also suggests type 1 diabetes. Treatment focus managing blood sugar level and insulins and diet and lifestyle. That's usually what happened with type 1. But there is a terminology called honeymoon period. Most people with type 1 diabetes have a period of time after their diagnosis where they still have remaining cells in the pancreas that still produce insulin. So there is a chance that they do not need to use too much insulin to take care of their sugar. This is called honeymoon period, where they, I don't know how the terminology comes out, but it's because it's not forever. But it ranges from 1 month to 13 years. So research and clinical study are still ongoing to improve how to make the honeymoon period not ends. Because during the honeymoon period, many integrative medicine doctors or integrative medicine endocrinologists, they try to find the cause, possible cause. Let's say they test the bacteria, they test the viruses, whatever might cause it, and they target that treatments, like treating the viruses. Believe it or not, a very low number though, percentage of these type 1 diabetes, they reach permanent remissions, meaning that they do not have diabetic anymore. But, due to very small number of patients, so parents have to work very, very closely with the doctor for their children. Now, what is gestational diabetes? This one occurs when there is a high sugar level during pregnancy. Hormone changes during pregnancy also affect the insulin, which brings about high blood sugar level. The greater risk includes those who are pregnant after age 35 and have a family history of diabetes, or if they have a history of polycystic ovarian syndrome, PCOS, polycystic ovarian syndrome. Blood sugar levels usually return to normal after childbirth, but this population, this patient who has gestational diabetes has an increased risk to have a type 2 diabetes. For any diabetic, type 1, type 2, or even type 3, there is a type 3. Here are some proven methods of managing and minimizing organ damage. Diabetes is a condition or a disease where it doesn't kill you, but it kills the organs that you shower with sugar. That's why we always said that sugar kills, right? Because the sugar damages the arteries, so it affects the cardiovascular problem, cardiovascular symptom, I mean function, and it affects your eyes. It's called diabetic retinopathy. It affects your kidneys. So many diabetic patients that cannot control their sugar, or with the even with the insulins, will eventually have kidney dialysis. And what else? The neuropathy, yeah. So some of them they have studied, and there is a link between diabetes and cancer. In fact, my own grandmother, she has diabetes since she was maybe 40, 50 years young, and she was controlled very tight with all what she eats and the treatment and everything. And we used to fight. I know about diabetes since I was very young, and my father told me to stay with them in Jakarta, Indonesia, because my grandma has had diabetes. So I decided to, okay, I'll stay with grandma also. And I was the police, and of course she did not like me, but eventually she did not die of her diabetes, but she died of a lung cancer, complication of the lung cancer. She was 80, 82, I think 82 years old when she passed away. So back to diabetes type 1 to 3 management. So number one, you have to exercise. Somehow, if you exercise 30 minutes a day or 3 hours a week, so about like maybe every day, okay, 4 or 5 times a week, every day 30 minutes, and usually it's cardiovascular. If you like to dance, you like to Zumba, you like whatever, just do an exercise that helps you maintain your sugar. Then you have to eat healthy food. I'm going to go through some healthy food here, which is low on saturated fat, and then rich in protein and high in fibers, and mostly soluble fibers, uh, like a psyllium husk, okay, and it's very soluble fiber is very easy to just buy the powder and then just make it and drink it, and it will actually absorb the sugar and the fat and take it out through your bowel movement. So you have to monitor your sugar if you're diabetic according to what is recommended to you. And right now, people can just prick their fingers, but also have a continuous blood monitoring system, and that one helps people to lower the average of HbA1c, which is the monitoring for diabetes. You have to take your medication with on a regular time or scheduled time on regular basis every day. You cannot miss this one because you are still alive and you still have to eat, right? And every food you eat, they have calories. You have to monitor your cholesterol as well, because fat is sugar, sugar is fat. In the body, it actually metabolized, and it becomes, when you eat sugar, it becomes fat. So maintain your healthy weight. So you cannot just go yo-yo dieting with diabetes. Some patients who are put on insulins because they cannot maintain their sugar on, let's say, metformin, which is a medication that makes the insulin more sensitive, which I prefer to put my patient on metformin because it does improve their brain function also, rather than put them on insulin, which is the opposite. Okay. So some healthy food. What healthy food you have to eat? Well, you can eat eggs as much as you want. Fish such as salmon, mackerel. It has a lot of DHA, essential fatty acid. You can do cottage cheese or healthy fat from avocado. You can eat olive fruits or olive oils, extra virgin olive oils. I would recommend 2 tablespoonfuls every day and mix it with your rice or your salads, and eat your nuts for protein, and you can do nut butters, and also a lot of seeds. Seeds would help. So what about good base food supplements? Because this is how I practice. First, I will detox the patients. Okay, so improve their liver function so the pancreas can communicate with their liver to keep the sugar in the cell or in the liver. So I need to make sure the liver is not fatty. So I usually detox. 2 weeks, every 3 to 4 months, they go through detox. Education is very important with diabetic patients. So, and then I will explain their body has a problem. So they need good food-based supplements or plant-based to support the metabolism of sugar. That, of course, besides the medication, which is metformin. Metformin is very popular recently because they found in the study that metformin improve your cognitive function or memory. So many people who do not have diabetes now they want to take metformin, and I recommend to some of my patients who are pre-diabetic to take metformin 500 milligram once a day, or if that doesn't make their sugar drops, right? So what other supplements? Well, like R lipoic acid. How about that? That one about like 4 to 500 milligram a day, and you can add biotin, L-carnitine, carnosine, about 500 to 1,000 milligram a day. Chromium. The chromium do not do picolinate. Just select the polynicotinate. The polynicotinate had a study that is 60 times more effective helping your insulins and metabolize the sugar. So the chromium is about like 500 microgram to even 800 microgram. Now for people who like to munch sweet things or dessert, the chromium taking long enough, maybe this is a very inexpensive product, okay? Like maybe $3 for a month supply of a good chromium, and you can just take it, and after 3 to 6 months you can tell that you don't like sugar anymore. You don't like too sweet. Sometimes you will be so surprised, this is so sweet, and then you remember you used to like it. So chromium polynicotinate, all right? Coenzyme Q10, the quinol will help your brain also, about 100 to 300 milligram. Some patients found that they have to take 600 milligram to 1,000 milligrams sometimes. And then that will also help the microcirculation and improvement in the numbness and tingling. Essential fatty acid, EPA, DHA in the ratio of 2 to 1 or 1 to 1. So up to 1,500 to 2,000 milligram a day. And then fibers, soluble fibers. The difference, well, the insoluble help you to move your bowel, okay, for your, let's say, constipation, but soluble fiber for diabetes patients or for people that has a fatty liver, this one requires a lot more water, otherwise you get constipated. And you can take 20 to 30 gram a day. More fiber is healthier cardiovascular anyway. Flavonoids, which is antioxidant, this will help to reduce the damage of the organ. And then that includes like quercetin, okay, 500 milligram a day, yeah. How about magnesium? You know magnesium is the king of the minerals, right? So take magnesium. How to take magnesium? Now the best magnesium now for for the cells, it's called bisglycinate. Magnesium is individually dosed, meaning that your magnesium requirement and mine is different. So you start with perhaps 500 milligrams to 1,000, but if you don't see any difference in your stool, then you have to continue taking until your stool is soft. That is your dose of magnesium. And you know, magnesium is very good for any situations, not only diabetes. And N-acetylcholine, 500 to 1,000 milligram a day. This is against oxidative damage or stress. Silimarin, 600 milligram a day. Vitamin B3, which is niacin, it's for proper function of the enzyme. Vitamin C helps ocular complication, the diabetic retinopathy. Vitamin E, 400 IU, reduce the risk of organ damage. And for the weakness and fatigue, we can use DHEA. It ranges, the women can use 25 milligram and the men can use 100 milligram a day. What about food-based, food, okay? Yes, cinnamon. Okay, cinnamon, you can take 175 milligram 3 times a day, or brown seaweed, bladderwrack, white kidney beans, 400 or 500 milligram twice a day, green coffee extract. Have you heard of that? It's very good for also lean body, right? 200, 400 milligrams 2 to 3 times a day, green coffee extract. Garlic, 1 to 2 grams a day. Garlic is excellent, but some people, they are very sensitive and they have leaky gut of a certain food, then don't take it. Green tea, 750 to 1,000 milligram. Vitamin D, don't forget, 5,000 to 10,000 IU a day. Don't worry about vitamin D because the toxic level is very high. It's up to 300. So if your level is not like 60, 80, then you should improve your vitamin D and test it again in 3 months. And if it's above 100, don't have to panic because it's not toxic. Only toxic when it reaches like 300 level, okay? Now, blueberries is good, even though it's acidic, but it's very good because it has the highest antioxidant level in berries group. Ginkgo, even though it doesn't fail to be the #1 to improve your memory, but ginkgo biloba also help your sugar, help to level your sugar. Also, bilberry also is good. 100 milligram a day is good enough. Now, what kind of test to follow? Regular test for diabetes is fasting blood sugar, 2 hours postprandial. That's good to check once in a while. And then HbA1c, fasting insulin, very difficult, but it's good to know. 25 hydroxy vitamin D level, coenzyme Q10, that's also very rare to check. Then omega score. I think all of these are very complete for endocrinologists usually, but I usually just check HbA1c and fasting blood sugar, and then vitamin D. That's good enough. If I talk about diabetic type 3 in the future, that is linked to Alzheimer's. Usually, this is type 2 diabetes with an insulin resistant. So you have insulin, but it's not working. And then it's insulin stay high even though you're fasting. You see, when you're fasting, you have no sugar in your blood system. So pancreas is not called to produce insulin. But then when we test and insulin remains high, that is called insulin resistant. And this is linked to dementia or Alzheimer's. What kind of things that we should be mindful with diabetes. It's the complication. I had already mentioned it. So over time, the diabetes complication can affect major organs in your body, such as a cardiovascular, like the heart and the lung and the kidneys and the liver. Okay. So maintaining blood sugar level can dramatically reduce the risk of many complications. Eventually, diabetes complication may be disabling and even life-threatening. I have to tell you a story about my cousins. Well, thank God that my siblings, all of us, do not have diabetes, and when we see that we have a little bit increase of HbA1c, we'll just do dieting, because it's very markedly. Many in my family, we have diabetes. I even have cousins, 28 years young. He probably had juvenile diabetes, right? 28. And he could not level his sugar. And one day he probably stepped on a nail, and he had developed wound in the leg. But because of the numbness feeling, most diabetes cannot feel like we do, and it developed gangrene. So he got his ankle foot amputated one time. Then apparently the amputation, the wound where it's amputated did not heal pretty well, and it spreads. The bacteria still stay there, and then it is infected more of the part of the long stump, right? And then it went to the knee level, so they have to cut at the knee level. Unfortunately, with this diabetes patient, they don't heal easily, and it went to the hip area. They amputated up to the hip area, and he passed away, 28 years young. Very sad. And many of my cousins, I'm pretty sure many of them have diabetes. But I do hope that they understand now, with the lifestyle changes and diet and nutrition, we can help them. Your healthcare team usually includes certified diabetic educator. They are not doctors, to teach how to use the insulin, how to inject if you need an injection, and to understand how you maintain your sugar. And then dietitian, social worker, or mental health professionals for healthy food. Then pharmacists, they know about your intake of injectable insulins or medication. You cannot over drug yourself or over inject the insulin, because you can go to hypoglycemia and then you can die. For example, before you go to bed, let's say you eat too much and you saw, oh, your sugar is 300, then you inject more insulins. You do not know if that insulin will lower your sugar to normal or below normal. You might not wake up in the morning. That happened to one of my patients. Let me tell you a story real quick. He did not come for his appointment. Now, we knew, okay, that he was going to have cataract surgery. So apparently, this is the story. He went, he's aware of that any surgery for diabetes might not heal properly. So he wants to regulate his sugar. He went to the pharmacy and took his refill of insulin. So that night, for some reason, he gave himself a little bit more insulin. So he did not wake up. So his nephew were looking for him. When we called the nephew, your uncle never showed up for his appointment. You know, after the cataract surgery, he was supposed to come for an appointment, but he didn't make it. So the nephew went and found that his uncle actually died in his home, his own home. So very careful when you try to reduce your sugar. In fact, for diabetes, the most important is not to have low sugar. They become panic usually when the sugar is low because of all the symptoms I told you about the low sugar. But if it's high, you can go to diabetic ketoacidosis also, which you can also go into coma. So it's very, very sensitive. Okay, so let me see if I have some questions. I cannot see you either. Oh, I see. Sorry, that was the video when I did not open. Okay, sorry. Thank you. So, what are the ways one can lower one's blood sugar level? What are the ways one can lower one's blood sugar level? So, I had mentioned many ways. Okay, including diet and including medication. Of course, there are several kind of medication now. Remember, today is just an overview, so you know what I'm going to talk is about more diabetes. And next month, or the first week of every month, now we talk about COVID and vaccine. And then the second, third, and fourth week, I'm going to cover endocrinology. So that is like metabolic disease. And so the second week next month, I cover diabetes and its treatments. And then the following week, diabetes and its complication. So we can use a prescription drugs, or we can also use food-based supplements or a plant-based supplements. I have what we call GlucoGuard. It's a drink. I told all my diabetic patients to drink that one every day. And we get a lot of compliments from patients about the GlucoGuard for diabetes. And I recently learned that the cost of insulin is very costly. Why is it so expensive? If I start talking about the drug cost, and we'll go into politics. So unfortunately, we were able to lower all the costs of insulins and all the things in the past administration, but now it went back up, right? So unfortunately, this is always the case like that. I feel sorry for people who are not covered when they need insulins, because it is very, very important. And well, let's just hope that this will be taken care again. And thank you so much. And we went a little bit over, but next week is COVID and a vaccine. Okay, thank you for listening. And if you like the program, please give us a thumbs up, and you can write in comment your questions again, and I will, from time to time, I will check, and then I will try to explain. Okay, I'm Dr. Maria Sulindro, integrative anti-aging, practicing in Pasadena, California. Thank you.